Hello, my name is Sheila Roman Gallegos.
I'm Bailey Beaver.
And I'm Autumn Smith.
And today we will be talking about our career pathways for Class 510 with Mr. Boyer.
This is our interview for Career Pathways. So we interviewed Dr. Kyle Tice at the Beckley VA.
And this is specifically for federal pharmacy.
The question is, does your job consist of patient interaction or does it rely more on interprofessional relationships?
I'd say it's actually a really good mix of both. So as you can tell, I'm at the hospital here now. So I cover the night shift. So we started about right after 5:30 and we work until about 6:30 in the morning. And so any new admissions that come in, if we have questions about the medications, anything like that, it's real easy to pop down and ask the patient a question. Especially like one that I get all the time is patients that are on like a weekly medication. Just run down real quick and find out, which day of the week that they take that to make sure we get it entered into the system correctly. As for interprofessional, ton of interprofessional as well. We have recently, I'd say here just a couple of months ago, we went to 24/7 provider coverage. It used to be we just had the ER physician that covered basically the entire hospital during the nights. But we now have a hospitalist here every night, which has been fantastic. So, real time, changes that need to be made to the providers, dose adjustments, anything like that. All I have to do is call or send a message and really can have that done in a matter of seconds to minutes.
So the next question is, what is the most appealing aspect of your job?
Most appealing aspect of my job? It's a great question. So we are a relatively smaller hospital. Our acute care floor is about 13 beds. ICU is 5. And then our long-term care, I'm not 100% sure on the numbers up there. Sometimes they double up or not. So roughly, I'd say anywhere from 14 to 20 beds up there. So we are a relatively small hospital, but it's really nice being a small hospital because I feel like I have a huge impact on patient care. Being able to, if we don't have a ton of admissions, being able to go through and review patient medications, just assess appropriateness of therapy and that, find anything, having the provider here make a recommendation, and usually it's addressed within a couple of minutes, has been really awesome. Me personally, I am emergency medicine. Critical care is kind of my interest area, always has been. So being the only pharmacist here at night, a lot of the times I will just go down to the emergency department and work out of the emergency department. So it's really been awesome to kind of help them out. If we get anything critical coming in, being right there on the spot, pulling medications, making dose recommendations, answering questions, and that has really been awesome.
So on the flip side of that, what did you say is the least appealing aspect of your job?
Least appealing aspect. I'd probably have to say being the only person here at nights. That can be a little bit difficult, but we have started to work on that. We have just got a pharmacy technician to help for a part of the night. So while that has been relatively difficult, especially here with the most recent surge of COVID, that's hit us pretty hard. So that's been very difficult, so any IVs that have to be made, any medications that need to be pulled basically just came down to either myself or the other pharmacist that covers on my off week. So it was a lot of running, can be very stressful at times, especially if you have multiple new admissions in that. But having a technician come on and help has been awesome.
Okay, and for mine is, what does your day-to-day work schedule look like?
All right, day-to-day work schedule. Like I said, we come in at about 5:30 in the evening. Usually when I first get here, there tends to not be a whole lot going on. usually stop by and see the pharmacist that is working before me, see if there's any important things that they have to hand off. Um, just getting a rundown of what had happened for the day so far. Usually then just go check emails if there's any orders or anything that need to be verified, get caught up, because the other pharmacists that here that it is covering both inpatient and outpatient at that time. So help them out, get caught up. And then from there, it really just depends on how busy of a night it is. If the emergency department's busy, like I said, I'll usually end up heading down there, helping them out. Any new admissions that come in, we cover those throughout the night. Any IVs that need to be made, medications that need to be pulled, we'll go ahead and cover those. That's where some kind of unique things that we do. My counterpart and I, we both took on, the VA has a process called prior authorization drug requests, or PADRs is what we refer to them as. And we have started helping out with those as well. Because there are some nights that aren't extremely busy. So we help some of the pharmacy specialists out, and we review prior authorization requests for PPIs. So we do have a hierarchy of, these are our preferred agents. Any ones outside of those need to be approved. So we'll review those, take the time to verify those or not approve those. And then send our recommendations to the provider. If we didn't approve them, hey, we would recommend this instead. Are you okay to trialing this? And then going from there. Other than that, I think that's, like I said, it really just depends on the night. There's nights that I've been here where there's not a whole lot going on, and there's other nights that I feel like I blink and it's been 12 hours later. We do, one more thing that we typically do on nights, we process outpatient orders. So veterans are able to call in or submit requests for refills of their medications across our couple of different campuses. So we go ahead and process those. We have a central place where those are shipped from as well. So we go ahead and process those, get those sent over, and then they can be shipped out once they've been verified.
Situation. So what would you say is the typical income range for a career similar to yours?
So it's really going to depend. I actually went and looked up some of the positions that are listed right now across the VA systems in anticipation of this question. What really determines that is there is a locality adjustment. So every state has, or really not even state, because the states are broken down into districts by the VA as well. So it's really dependent on what the locality adjustment is. Just as an average looking through, I mean, there were positions listed anywhere from just under 90,000 to 135,000.
What are some other pathways that are available for government or federal pharmacy?
It really just depends. So there are a whole lot of different entities that fall under the government. So a lot of the Indian Health Services, pretty much all of them fall under the government positions. Any of the VA facilities fall under government positions as well. And then you have your more kind of national. So looking at, working for the FDA as well, kind of.
Okay, that's great. Another question we had is, what made you choose this career path?
So I had just finished up residency. I actually stayed local, of course, went to UC, did my PGY1 residency up at Charleston Area Medical Center. And then was kind of looking for positions in emergency departments. I had applied to a couple of emergency departments, was waiting to hear back from them. And one of my classmates that I graduated with actually works here at the Beckley VA. And she just happened to message me one day and said, hey, we are looking for pharmacists. If you had any interest, go ahead and drop your resume off. And our boss will be in touch with you. So I went ahead and submitted that, just to kind of see what was going on. The original position that I applied, or that they were talking about, was actually more of a home-based primary care position. So you review patients' medications. The providers actually see them in their houses, and then you can make real-time adjustments to their medications, based on blood pressure readings, blood glucose readings, and that. But when I got to talking to the director here, he said, hey, we're looking at starting a midnight position. And we just got to talking about it. I told him I was really interested in emergency medicine. And he said, honestly, with this position, he said, you can work entirely out of the ER if you want to. He said, as long as, new admissions are taken care of, you can go work out of the ER as long as everything gets finished. And that really, like I said, already applying for a couple of ER positions at the time, that really swayed me to this position. For sure.
So what would be your best advice to a pharmacy student that is looking to pursue a career in government or federal pharmacy?
Best advice. Great question. Like I said, this position just kind of came to one day. But if you're looking into wanting to, so the Valor program actually is not here at the Beckley VA anymore. But the Valor program is on the summers during your pharmacy school years. You can kind of get your foot in the door, do some internship during the summers. Of course, it's paid internship, so you'd be getting paid for that as well. To really already have your foot in the door. We have rotations through the VA here as well. So you could look into doing some of your fourth year rotations through the VAs as well. And we do have a residency program as well. So if residency was something that you were interested in, you could always learn more about that, apply for the residency program. And then of course you already have your foot in the door here at the VA. I think that's another really unique thing about, not just the VA, but government positions in general, is that once you are licensed in one state and have a government job, you can practice in any facility. So if you decided, whatever location you originally were hired in, you wanted to pick up and move across the country to another government position, as long as you maintain that licensure, you don't have to get licensed in the state that you move to, as long as you stay within the government position, which I think is really nice.
So what we learned from this interview was that I personally didn't know that if you joined the VA hospital, any VA hospital, and you transfer, let's say you're practicing here in West Virginia and you transfer over to California or any other state, you don't have to take the MPJE for that specific state because you're transferring from within the VA. So it is not necessary to take the MPJE.
The biggest thing that I learned were all the opportunities there were inside the VA, from pre-grad stuff like internships and programs to residencies, and also once you're employed by the VA, just the way you work up the system.
And what I thought was interesting is we already know that pharmacists are very trustworthy, but the VA specifically holds them up to a higher standard, because Kyle told us that it was just him and a tech for only a few hours, and he was left there all night by himself in the ER. So I thought that to be very interesting.
Yeah, so thank you for watching our interview and our video, and we will see you in class.